Good evening. It's our honor and privilege to welcome you to the Friday evening BW Healthcare podcast. Along with me is my editorial colleague, Kavi Bhandari, who's the editorial lead for BW Healthcare World. And we have two leaders from the business side of healthcare, because essentially we're discussing the business side of healthcare. Let me welcome our guest, Mr. Mohit Nirula, who's the CEO of Columbia Pacific Communities. And welcome, Mohit, to this conversation. I hope our viewers and our readers are able to go back, Richard, in terms of the assurance that the healthcare sector has, stood the challenge of the last 8 weeks and kind of against all odds delivered. And I know we all expected to deliver more. I'm sure directionally we are moving in the right direction of increasing our healthcare investments and being more conscious of what we need to do to be able to build that. So welcome, Mohit. We look forward to your input. We also have Ms. Richa Debgupta. She's a senior vice president at a leading chain. That company is a pioneer in healthcare in India, and for many years has been present in almost all sectors of healthcare, including preventive healthcare, curative healthcare, mental well-being. So welcome, Richa, to this conversation. Let me, Mohit, start with you and ask you, the last 8 weeks were very different than the first 12 months of COVID in terms of the impact on the people of the country and the stress it put on the healthcare. Give us your opening comments in terms of how did you think the Indian healthcare ecosystem fared in terms of its response to this huge crisis?
So, Dr. Batra, I'm going to just upfront, in the spirit of disclosure, say that my 31 years preceding the 4 years or the 3.5 years with Columbia Pacific Communities was spent in the hospitality business with the Oberoi Group. So my answers may not be as medically sound as you may like them to be. But now heading a company which is primarily in the business of creating communities designed for seniors and looking after their needs as residents with us, I can differentiate the first wave and the second wave very vividly in my mind, because for us, we were under attack by a virus in the first wave that we couldn't see, that nobody knew anything about. And we really didn't know what the best response to it was. In the second wave, and please note that I'm talking purely from the point of view of our communities that we serve, the residents, the seniors who are our responsibility. The second wave, thankfully, they were vaccinated. 95% of them had their second vaccinations. So whilst outside the community, the second wave was far, far, far more lethal. We had the double protection of double vaccines. So to that extent, we were better protected. But insofar as your question of what do you think happened to the healthcare system, a lot of people told me that the healthcare system got collapsed.
Overwhelmed.
And I actually believe our healthcare system got exposed for what it was. What collapses is what exists. But when it doesn't exist, it just gets exposed. So I honestly believe that the second corona wave showed us a very clear 100% clarity mirror and the picture of our healthcare system. And I'm not talking of those of the people who populate that system. They've gone above and beyond. I'm talking of the infrastructure that is supposed to serve across the country, urban and rural. That, I'm afraid, is not a pretty picture in that mirror.
Okay. And again, while this wave impacted young people, but because of comorbidity, the older people were a bigger risk, considering their age, considering their comorbidity. And clearly, for at least 2 decades, we've been talking of, the non-communicable diseases are taking a bigger toll on India's healthcare ecosystem. And we still haven't, preventive healthcare is there. But I think post-COVID, if there's one silver lining, is that the preventive healthcare will be under more focus. Possibly individuals and organizations will be focusing a lot more on that. So hence the seniors, that the community that you look after become, and I have to tell you, Mohit, that We in April first week was about to launch our conference on seniors, on senior living, on healthcare at home. We were going to do a physical conference, and then COVID came and we didn't do it. But hopefully in August we'll do it as a full-fledged, because we believe in terms of the healthcare segment, the healthcare at home, the healthcare of seniors, and the way it needs to be done will be a very big opportunity and a responsibility, so to say. If we can't look after our parents, grandparents, then clearly, karmically, we are not doing the right thing. Let me bring in Richa. Richa, again, your organization has been around for many decades, pioneering healthcare. Individuals set that up, and you're in almost every sector that matters. Give us a sense of how would you rate the healthcare sector's response to the last 8 weeks?
Right. So first and foremost, Dr. Batra, thank you for having me on board. Right. Now, when we talk about this current pandemic, right, let me clearly divide into two, and that's very apparent to us as wave 1 and wave 2, right? Wave 1, we did pretty well, right? And by end of the year, and January, February, I'm sure you also heard that India has fared quite well as far as managing the pandemic is concerned. However, the second wave is something which you use the word overwhelmed. That's exactly the word. That the complete healthcare infrastructure, healthcare delivery sector, to some extent, I would say to a large extent, even the pharma companies who are manufacturing those medicine, which was supposed to support the COVID treatment, all of it was kind of, overwhelmed completely. You're aware that there was an oxygen shortage. You're aware there was medication shortage, and of course there was a bed shortage as well.
And the personal shortage, trained manpower, which is a big issue that I will tackle with you at some stage.
Absolutely. So as Mohit rightly said, that when it comes to, so see, when you talk about infrastructure, there are like different parameters to it. When you talk about man and machine, I would say to a large extent, they performed more than 100% is what I would say. They did their level best, right? There are a lot of human story which will come out, that how people sacrifice their own personal lives, their own parents being sick, but they showed up in hospital and they treated all these patients. But with that said, if we talk about the infra, it really kind of, didn't really live up to our expectation, our own expectation. One reason being, we know that we had acute shortage of healthcare infrastructure in a normal scenario. Forget about the pandemic, right? So what came to us in the second wave, knowing the intensity with it came, I'm not surprised what we experienced, because healthcare infrastructure has been an acute shortage, as you rightly said, whether we talk about number of people, whether we talk about the number of hospital beds, doctors, all of it. And that is what is here for all of us to see.
Beautifully put. And let me start with you this time, Richa. Again, I'm a doctor, but I'm a PhD scholar doctor, so I have a permanent head damage. But I'm not a medical doctor. Let me qualify like you, Mohit, and I understand your background is in hospitality. You come from the business domain, but spending 4 years in any domain can make you an expert, living and breathing the dream that you have or the responsibility you have. But Richa, one of the things that I understand from my discussions with India's top healthcare experts is that the manpower that we need, not just doctors, but the nurses, just putting in money into physical infrastructure won't be good enough. We have to commensurately increase the number of trained professionals that we get every year at every level of the healthcare ecosystem, whether it's trained nurses, it's paramedical staff, it is doctors, it is the attendants, and so on and so forth. And I was talking to Dr. Trayan, and he said to me that they applied for a license 3 or 4 years back, and they hadn't got a permission for a nursing college for a long time. And clearly, sorry, I was talking to Dr. Devi Shetty, sorry. I must correct myself. And he said, like in engineering, we've one of the reasons we provide manpower to the world, we've been able to build the Wipros, the Infosys, the TCS, the Cognizant, because there are too many engineering colleges. So the supply is much more than the demand, which really creates the end result then. So do you agree with this assessment that not only healthcare investments in terms of money in terms of better facilities are needed, but the manpower that is needed, and give us a sense through numbers of what kind of numbers we are talking on and what kind of investment should go into training and reskilling the manpower we need to be able to provide healthcare over the next 1 to 2 decades.
So, Dr. Batra, you touched upon a very, very important point, which is the manpower. So, see, while we can lay down the beds, we can buy the equipment, but if you don't have the man behind the machine, it's not going to really work. And that's where your paramedic staff, nurses, and doctors come into play. So, as we speak, in India, you require 6 lakhs doctor coming in, and you require 20 lakhs of nurses who needs to join in the workforce to ensure that we have sufficient number of nurses to cater to the patients. When we have such huge number in demand, right? And what needs to happen is that the healthcare education, whether we are talking about the nurses, GNM, BSc, or whether we are talking about MBBS doctors, the complete thing has to undergo a reform. So reform, I'm not purely talking about the syllabus or the curriculum. What I'm talking about is the basic thing, that the infrastructure requirement, the professor they need to hire, right? So I think for years together, that's my assumption that, for years together, we haven't really looked at it, right? When you get into a medical college, you get a feel that, it's larger than any other university, right? And when you go into the foreign country, all you see is it's a glass and brick building where you're running the medical college, right? So what you require is, end of the day, the good end product. And what it would take to make that is something which really needs to be rethought, needs to be think through, and we need to follow that. And then only we would be able to match up to those numbers which we require in probably 5 years or probably a decade.
Fantastic. And again, I would talk about technology, telemedicine, telehealth, and the whole value chain. But let me ask the same question to Mohit. Mohit, in terms of, if suppose 10,000 crores or 20,000 crores, and again, you've been talking in numbers. I don't have to tell you that the healthcare investments in India are the lowest for the kind of country we exist. We are, world average is 2.6%. And we have allocated more than 2%, but we don't spend. We should spend more like 6-8% on healthcare to be able to stay where we are, and hopefully the damage caused in the last 15 months, we are able to deal with it. Plus, one of the aspects, since we are about business of healthcare, and we will talk about healthcare, is that in the last 16 months, the loss to healthcare businesses, both large, mid-sized, and the GP, whom I call the SMEs of healthcare, your local GP, has been almost $2 billion because people stopped going for visits. People, we do telemedicine, but it's not the same. Yes, it works in certain cases. It is the second best alternative. There's value. So give us a sense of, if we deploy money in the future, where that money should go. And I will focus on senior living and healthcare at home and community living, and how do we take care of elders. I'll come to that specifically towards the end. But tell us, what should be the thirst? If you were the health minister of the country or the finance minister of the country, what would you do to be able to build the infrastructure at least for the next 5-10 years?
Well, the answer that I give to this is based more on my research as I was preparing for this webinar today, and I spoke to colleagues who are in this space, and some of the numbers and where we are today is not Dr. Batra, a consequence of what's happened over the last 16 months. Where we are today is a consequence of what we've not done over the last 70 years. When we started off as an independent country, 80% of the healthcare in the country was driven by the government and in the public sector. Today, 80% or more than 80% of the healthcare is in the private sector. 70% of India lives in the villages. You're right when you say that we barely spend more than, again, depends on which numbers you want to believe, 1.3 to 2.3% of GDP on healthcare, when countries like the US spend 16%, right, and are unhappy with the healthcare system that they have. We have 8.5 beds per 10,000 people in this country. South Korea has 100 beds per 10,000 people. So the gap is just humongous. And therefore, what we need to understand is that there are two things that need to happen. Number one, the government needs to bring on board people from the private sector, people from who are not necessarily bureaucrats, but bring in the expertise from outside to look at an ecosystemic change. And it starts right from education to physical infrastructure, to distribution systems, to reaching the poorest of the poor in the villages, and the entire value chain that connects all of this up before we can speak about anything. How much we are also hampered a little bit by the fact that that healthcare appears in both central responsibility and state responsibility, depending on the side or the paradigm from which you're viewing it. To my mind, it needs to be a national responsibility. And therefore, to that extent, if it requires a constitutional review of putting, you can't fix it unless you accept it's broken, and the responsibility of fixing it is ascribed to one body. Even with vaccines, if you see the disparity between who's supposed to get it is still not getting resolved. So the point I'm making is that it is a ecosystem as a whole, and it starts from education, banking, zonal work in terms of urban planning. It goes on to loans, it goes on to the taxation infrastructure, it goes on to getting permissions. So every single aspect, and therefore I don't believe it's just a question of throwing money at it. What we need to do is get the best brains together, look at the entire infrastructure, and then start to put monies into a systematized execution aimed at making sure that the next time the country looks at the medical system for help, it is designed to deliver it. So I'm afraid I don't have a rupee paisa number, but I do know that the mechanism that we have currently will not produce the results that you are asking to be produced by just money.
Richa, your comments?
Well, I think you asked a very interesting question that, if I was one of the minister and if I had to kind of spend that money. So see, I have got very simple answer to that, Dr. Batra. One is that the insurance, right? Because affordability in our country is still a huge, huge issue, right? What surprises me that it's not only whether you have the money or whether you don't have the money, even people, those who can afford health insurance, are in the habit of not taking health insurance, right? That's one part of it, which pulls down the affordability part as far as healthcare is concerned, even further down. Right. Second thing I would talk about is the technology. Somewhere before we started this webinar, we were talking about it. That why is that while the numbers are going down, but our ICU are still full. That today, if you would like to have an ICU bed, there might be a difficulty. Reason being, if you look at tier 2, tier 3, I'm not even talking about the rural India at this point in time. See, the technology is far below as compared to any metro city as far as
and basic technology, connectivity.
Yes.
Access devices, and
absolutely.
not just in an advanced way.
Absolutely. And you won't be surprised that even if you go into a tier 2, tier 3 city, right, you would not have a good ICU infrastructure, which is basic for any city, right? So I think there the investment is required, as you rightly said, in terms of connectivity. And somewhere we would come to that point of telemedicine or teleconsult. That is something which becomes very, very important when we are talking about accessibility. So as we say, affordability, accessibility is the key problem today in healthcare. Both of them needs to be tackled in terms of having an insurance, mandating it. What surprises me is that you can't take your vehicle out if your insurance has expired, but you can roam around, with so many viruses, bacteria all around without an insurance, thinking that, somebody else will take care of your health. So I think that's absolutely not done.
Fantastic. Now, let me focus on, you talked about, I want to give you a personal experience. I'll give you two. One is around 23rd, 24th April, my mother would be 80 on 6th June. She had fever. And I don't put my public life on Twitter but my wife requested that I don't waste time, and I put out a request for a bed, and I did on a Sunday tweet it, and I got I think another silver lining is that people who don't even know you are willing to help and do things that you don't even expect from people you know for a long time. So I think there is a lot of people who are really humane in the real sense of it. And luckily, my mother's cured and we treated her at home. And she was symptomatic, but her RT-PCR was negative. And she has all the comorbidities. She has sugar, diabetes, she has blood pressure. She had a stroke 2 years back and a brain stroke. So, luckily she's done well and she's okay. But the fact is, we were very worried. We were taking her to the hospital because I spent 7-8 hours taking this decision, and I was very worried. Am I really doing the best thing for my mother by not taking her to the hospital? And I have to tell you this story. And it was very, very tough to decide what should do, whether do it at home. But after 7-8 hours of maybe 50 phone calls, 20-30 serious discussions with people who understand healthcare and COVID and my own family, I decided to cure her at home. I mean, decided to address who am I to cure, God cured. But, since the decision was mine to take her to the hospital or not, my dad leaves it to me. And, we got cured her at home. And I must tell you, next day I got, I don't know, but I did get healthcare at home from one of the companies represented on this panel. And I don't want to embarrass anyone, so I will not take names. And the boy was very good, and he sent. But the nurse that came did not know how to put a IV, because he was also, when I had, and I'm not a cribber. I don't crib. I don't put out, if I don't like a product, I don't put out a tweet and this. In fact, people who do it, I look down on them. I'm not, I shouldn't look down on anyone. But if small product is not working, don't make too much noise. Change it or forget it. But they returned the money, and it is organization related to you, and they returned my money and said, if you're not happy, don't worry, we'll return your money. I said, it's not about my happy, she doesn't know how to do. Then I got another one where one of my classmates is a large investor in that company. He runs the private equity, and they did, and the nurse was okay, but she was very basic. Luckily, the whole week she was able to give steroids to my mom, and then whatever follow-up treatment, and she would take blood pressure and all that, sugar every 3 hours, because with Medrol the sugar goes up, and so on and so forth. The fact is that my Masi fell ill, and exactly the same thing happened with her. So clearly, healthcare at home is something that we haven't focused on, but clearly that's the way forward, where there's trained manpower. Second is, you talked about tier 2 cities. I have a colleague and we lost him unfortunately 3 weeks back. He was about 42 and he had 2 young daughters, and we lost him one day after his daughter's birthday. And he's from Aligarh, so he got this and he did not even tell me. He said, I have fever, So he called me Saturday night, and I asked him all the questions, and my CEO asked him, and who was helping him pally with him, and more pally with me, still a little formal relationship. And he went to Aligarh, to his hometown, because he got the best hospital, he got a bed. And while he got all the treatment he got for about 2 weeks, it looked like he was coming back and he was okay. He went to heaven. Now, the 2 questions that I'm asking is from these is, do you think healthcare at home will become an even more serious play for big healthcare players? And what do you think needs to improve about healthcare at home? Because we know that we have to expand our healthcare ecosystem. Not everyone needs to come to the hospital, and oxygen, and if there is IVs to be given, they can be given at home. And you can consult a doctor as long as it's happening under a doctor's supervision. That's the only qualification I put. And I must tell you, while doctors were very kind, they were overwhelmed. It was difficult to get doctors online. Luckily, it was easy for me. But, I can tell you by my experience and my friends' experience, and doctors are doing their best. No, I'm not complaining. They were just overwhelmed with the number of people they were looking, and they were still making an effort to look at people at 10:30 in the night. I did consult a pulmonologist of your hospital at 10:30 in the night. He gave me a time and I said, I want to discuss my mom's case with you. So I'm just saying what needs to be done to expand the healthcare system.
So, Dr. Batra, the point is, as we started, that all of us understand the market, right? And we always talk about demand and supply. So healthcare is such a subject where demand is huge. But if you look at the supply side, supply on all aspect, whether it is bed, whether it is manpower, whether it is equipment, supply is significantly less. So when we talk about home healthcare, if you ask me, that is the next step in healthcare. That's the huge business opportunity which many people are seeing it. They have started it without taking name of the companies. If you look for it,
Every player, yes.
yes, if you look for it, probably 10 companies you would see. Some of the large healthcare players also have ventured into it because, as you rightly said, when we want to discharge the patient, because we want people to leave hospital as soon as possible, as feasible as it is possible, as long as they're stable, they must move out of hospital environment. So we try to do that. Right. And the next question comes in, can you refer me to an agency or can you tell me a home healthcare person who's reliable? See, the word is reliable. That's where, if you ask me today, I would give you a list of 4 or 5 saying that while I can't guarantee the services of what they would deliver or the kind of nurse they would send, but they are the people who are there in the market. So if you ask me frankly, even if barring some of the people, even if I'm not happy with the services, where is the choice? And second thing comes on to when I spoke about that the 20 lakhs nurses more are required. When hospital is not able to fulfill their requirement of number of nurses, where would these girls go to serve at home? So so the problem is with the trained nurses, and if you don't have the trained nurses, what home healthcare would you provide? So that's where we are again, back to square in terms of getting
clearly training more healthcare professionals is also a solution, not just
Absolutely.
more money in terms of interest. That's very clear. And healthcare at home is only going to emerge stronger and
Yes.
bigger. Again, that's another. For many years, people have been trying to bring legitimacy and seriousness about healthcare at home, that it is also effective because we were forced to take it at home. We understood the value of that. And hopefully, as you said, there is a big enough business case for investments into it from a future standpoint. And again, Mohit, while you look after senior communities, healthcare at home and what you do in your role are intertwined, so to say, right? So why don't
the way I see it, you see, and where the differentiation comes between senior living communities and healthcare at home, actually stems from a very fundamental thing of the fastest accelerator of aging actually being loneliness. Your mother is fortunate and your father is fortunate that you stay in the same city as them and they are able to stay with you. There are, for every one of Dr. Batra, there are 10 where the careers of the children have taken them to different cities and different countries, in which case, remember, the parents are staying alone and the problem that you've just defined gets compounded multiple times over. And this is where a senior living community kind of caters to the entire spectrum of needs, from social engagement, physical interaction, where social distancing, which was such an unfortunately named term, actually what you wanted to achieve was physical distancing, but social engagement, because you don't want to just lock people away and leave them away saying that you are now safe. Because in all of what we've discussed till now, what we've not spoken about is mental health issues, which have gotten compounded hugely over this last 14-month period, because in our effort to keep them physically distanced, we've actually cut them off. And the point you make is very correct. The last CII report said that we need today 240,000 homes in tier 1 cities as communities designed for seniors. The current supply is 20,000. However, 4 nurses in a 200 home community can look after 200 homes, about 300 odd residents. Whereas home care at home now starts to multiply the person to patient ratio exponentially. As many homes, as many. And the other thing, Dr. Batra, that we have to realize is that not all home care needs to be at a very high medical level. There is also activities of daily living that now require support.
Yoga, breathing,
Breathing,
movement.
even
basic
help with eating your medicines on time. Imagine a situation where the children are not there, the couple is staying alone. Activity, having a bath, going for a walk, holding them steady, going up and down steps. There are several things. Nurses are at the apex level of care providers. Between being a 3-year qualified nurse and being a caregiver at home, which supports activities of daily living, and we have nothing. Richa was saying you need 6 lakh nurses. There are, in the last 15 years, we will add 60 million more seniors in the country, all of whom will require support of some nature. Average age has gone up to 73 officially. So what I'm saying to you is the tsunami that faces us of seniors, and even in normal times, Dr. Batra, 40 to 50% of all patients going to a hospital are already in the senior bracket because they are the ones who have and if we ask how many geriatric doctors are there in the country, less than 100 graduate every year. If you see the challenge your mother faced with the multiple number of comorbidities, it requires a doctor with immense experience to know how to balance one with the other, to prescribe medication with one with the other. It's not a thing that a junior doctor can do because they don't have the experiences yet of knowing that what am I trying to achieve with this case? Am I trying to cure the disease, or am I really trying to make the quality of life better? And sometimes one disease is better left uncured, but another disease's symptoms treated in a manner that the quality of life becomes better. These are very difficult calls that geriatricians can take, which a normal internal medicine doctor will find difficult. So the last 16 months in my time with senior care has told me that our country is woefully ignorant of the needs of our seniors as families become more nuclear, as globalization takes children away to different cities, as parents are extremely proud not to want to become burdens on their children, as children feel guilty of not looking after. Home health care, senior living communities, and a medical system is the least that we can offer seniors who've done so much for the country.
Fantastic. There are comments and questions coming, and I'll just read them. You can answer. Manas Patnaik has 2 comments and a question within them. In telemedicine, how can we offer continuous and real-time connection with the healthcare system? He then also goes on to say, if we want to stop the COVID from spreading, should we not focus on testing asymptomatic people, not after they're symptomatic, but before that? The RT-PCR testing is taking 2-3 days to get a report. How can this be fixed if there is a next wave after a couple of months? Shobha Pishe, I hope I got her second name right, is saying, good evening all. Basic healthcare facilities right now seems to be too expensive and not affordable, and it is not a solution for all. How can Pan-India weaken such reduced costs, especially in rural areas? And then I was reading a research on third wave, which is dangerous to the kids especially. Bitterly experienced 2 stages. And how do you think the juniors can be looked after, saved, precaution be taken? And he again goes on to ask, vaccine for kids will surely take some time. So what do we do to safeguard the lives of children? There are multiple questions, but how to make healthcare affordable? That's a big question that at least for 20 years, in some way or the other, I've been discussing here and there, always creeps up.
I'm going to bat that over to Richa. Shamelessly.
Richa,
So
affordable healthcare.
So affordability, I think somebody made a remark saying that the healthcare is expensive. See, affordability is very subjective. If you have the money, it's affordable. If you don't have it, it's unaffordable. Our problem in this country, our country, is that we do not plan for healthcare, right? The moment we say, I have heard people saying that the moment I say that, let's increase the premium for healthcare and hence the coverage for health insurance for us. The next question comes is that, are you expecting us to fall sick? Why do you wish that we should fall sick? Now, please accept the fact that, human body is like a machinery. Something can go wrong here and there. Not necessarily that it's always fatal, but if there is anything which is going wrong with your body, whether it is heart, kidney, brain, that needs to be treated. So you need to plan for your health. You need to plan for your treatment. Second thing, please do remember that all tertiary care healthcare, which obviously can result into fatal, because again, we are talking about all your vital organs. 70% of it is being provided by private healthcare. And let's accept the fact that somebody who has invested into private healthcare also needs to get some return in terms of to keep the machinery running. All of us understand simple management, that you need to generate as much to let your machinery keep going. And as we talk about in medical field, after 8 to 10 years, every machine is being considered obsolete. So you have to keep changing this machinery. And it would be interesting to know, when we make a hospital project, almost 60% of the cost, unlike a house or a hotel or a restaurant, 60% of my cost goes into the medical equipment, which needs to be changed every 8 to 10 years. So please do understand that there's a huge cost which goes into creating any healthcare delivery sector, right? And that money needs to be recovered. Third thing, obviously, when we are talking about public health, we have discussed this point, that currently the government's contribution of 1.7% of its GDP has to significantly go up for have a decent level of healthcare facility across the country sponsored by government. We need at least 5 to 6% of our GDP going into that, which is almost 3 times of what health government is currently spending. So these are the way. But in the meantime, what we need to have is a pooled resource, a pooled umbrella for everyone to get covered, which is as simple in as simple a term is insurance, and everyone needs to invest in that. Government has taken a lot of efforts around this, right? Each of the state government has come up with their scheme, so we are much better off what we were. I would say probably 10 years back, but yes, there is a long way for us to go.
Okay. Mohit, your comments?
Exactly the same. Insurance is the key. And, sometimes we are a bit myopic about insurance as well. Insurance, and we've seen those cases even now during the pandemic, where people with non-COVID related issues could not get beds at hospitals, got treatment at home, but were not covered by insurance because they were not hospitalized. Equally, there are several, and again, I come back to seniors, there are several times when post-operative care, like Richa was saying, the hospitals want to move patients back to a relatively safer home environment from at the earliest. When they move back, imagine a knee replacement surgery, a lot of work needs to happen with regards to recovery and rehabilitation post reaching home after 2.5, 3, 4, 5, 6 days in the hospital. All the physiotherapy, all the care at home is not always covered by insurance. So the point I'm making is, we need to look at insurance a lot more holistically. There is something which Richa touched upon, which is make it punitive and imperative that companies and individuals must ensure that everybody is insured. But we are again still talking about the organized sector. But it's a start. Let everybody be insured adequately. Dr. Batra, you and I will know of us being refused insurance by insurance companies saying you're not healthy enough to be insured. What it means is that our outflow risks are higher than the premiums. What they don't tell you is you'll have to pay a much higher premium because you're not healthy enough, and then we will insure you. They just take you off the thing because you're not ticking the boxes. So there are some things that we need to do as individuals, which is make sure we are covered, like Richa was saying. There is something the government needs to do, which is insist on insurance companies looking at it both as a service and as a business, and thereby taking a common sense approach to what is a reality. You can't just cover what happens in a hospital when a large proportion of recovery and expenses happen outside the hospital.
Absolutely. I couldn't agree more with you. I just want to get into the last segment. And you already in some way have alluded to it, and I'll bring in Kavi. Is about, you talked about 60 million seniors entering this community which needs attention, healthcare at home, which needs care because either their children are in different cities or are geographically in a different country or are in the same city but still maybe in jobs which require them to be away from home for most part of the day. So, how do you take care of them? And clearly, healthcare at home, elder health care, community living, senior care will only grow. But one aspect that we haven't touched about is the mental well-being, the emotional well-being. And I'll let Kavi ask you questions in that segment. Kavi, go ahead, ask your question.
Thank you, sir. Actually, you'll have spoken about almost everything. I had wanted to ask a few questions, but it's been covered. But I just had one question for Mr. Nirula and Ms. Debgupta, that how do you all maintain the emotional quotient, the physical quotient, and even the IQ quotient of not only elders, even young children during this pandemic, during the lockdown, during social distancing? People, mental health we discussed, but people are getting quite irritable, and also their emotional quotient is being affected. So even in seniors, what is the kind of infrastructure needed to curb something like this, or to improve something like this, or to help people in this regard?
I mean, listen, all of us as children of parents have probably used WhatsApp video, FaceTime, Zoom more than we've ever done to interact with our parents. What used to be phone calls are now video calls because, listen, face-to-face time is important. Speaking of Columbia Pacific communities, for us, the two things that we are extremely passionate about as a differentiator is community living, which means social engagement at all times, and positive aging. And positive aging is a belief or a approach to life which says that I shall be physically fitter tomorrow, mentally more alert tomorrow, intellectually more stimulated tomorrow. There is the person who runs a marathon at 100 is not Superman. He's just aged positively. And the person look at how we treat our parents at home. Baitho, baitho, chai main la dunga. What we are doing is we are atrophying their muscles with love. Actually, they need to be able to move. They need to be able to stay independent and do their things. But we actually atrophy them with love. So the approach that we take, and we took that right the way through this pandemic, is we said we shall not allow physical distancing to result in social distancing. We kept our seniors engaged. We kept our residents active. We kept them. And you will be amazed at their adoption of technology. Pre the pandemic, we used to have an inter-community competition on arts, crafts, sports, etc., where winners of Coimbatore would travel to Chennai to play the Chennai champions. Couldn't do that during the pandemic. We did Platform 2020, and this year we will do Platform 2021, all on Zoom. Singing competitions, instrumental. The participation is massive. The energy is massive. You could walk down a corridor and hear cheering and hooting home after home as their participant won. And to me, you see, children's a little different. Children need to expend a lot of energy because it's you can't keep them cooped up in a home. So I'll let Richa handle that because my children are 32 and they will object to being called children in the first place. So I'm going to let that part, let Richa from her medical approach tell you. But as far as seniors are concerned, if you keep them socially engaged, if they have a person to go for a walk with, if they have a person to read and debate the newspaper with, if they have somebody to play rummy with, and you can do all of this in our communities because you're ring-fenced from the outside. If you are safe within, then you remain engaged. And that's how we approached it. Over to Richa.
So, Kavi, you touched upon one of the most important aspect of health. When we talk about, actually, if you define health, mental health is one of the most important component of that. And you rightly said that when people are, cooped up into their houses, right, work from home, and all of that, it has given people, a different level of emotional distress. And if you look at it, actually, for emotional well-being or mental well-being, you require two aspects. Physical as well as mental engagement. And how do you do that? Physical engagement, obviously, even if you're home, you know, uh, do exercise for some time. There are plenty of online yoga classes which are going on, right? There are a lot of exercise that you can do depending upon your age. Elderly could do it probably sitting in their bed, and other people can just stand up, and wherever you have little free space, you can stretch yourself for an hour. That keeps you physically fit as well. Second thing, when you talk about the emotional health, you need to be socially active, you need to be socially engaged. Now, I think it was Mohit who said that we have been using from day one, since the time pandemic has hit us, we have been talking about social distancing. It is clearly physical distancing. Unfortunately, technology has such an important role to play, whether it is FaceTime, whether it is WhatsApp, whether it is, like you just want to do a kind of, you want to watch a movie, if that's what you like. There are so many ways that you can keep yourself socially engaged with people, know their well-being. There are certain people in your family who might have fallen sick, just checking on their health, keeping connected with them. All of that would help you in your emotional well-being as well. So it's quite simple. Third thing is, of course, if you have not had any hobby, this is the time where you're getting time to develop a hobby. Again, thanks to technology, all the classes, virtually all the classes you have online. You can enroll yourself into those classes, develop some hobby, and it would last you lifelong and help in your mental health through and through. With
Thank you,
that said,
Mr.
let me also tell you, sorry, Kavi, let me also tell you, see, for healthcare workers, it has been emotionally draining. This is the first time where I'm seeing actually doctors are having difficulty. They are finding it difficult to get sleep because they have seen more death than what they would have seen in a long period of their career, right? So they feel emotionally drained. So what we have done is that at Fortis Hospital, we have got a separate vertical for mental health, and they organize 3 or 4 sessions of online classes per day at your convenience. Whenever you're relatively freer after seeing the patient, you can just log in. You have online interaction with the psychologist, psychiatrist. You have like-minded people who would share similar experience. So we are creating this platform 4 times in a day, and people are really enjoying it. They're giving very positive feedback, and it has helped us pull up morale of our people, which includes nurses, doctors, paramedic staff, administrative staff, managers, everyone.
And
Thank you,
Kavi,
Mr.
I didn't know
Yes.
that we'd have, or when you were putting this thing together, we'd have somebody from Fortis and Richa on top of that for this. We just concluded a 2-week initiative between Columbia Pacific Communities and Fortis, which even Richa may not be aware about because we handle that.
I'm aware.
Which
It must be Dr. Parekh who did it.
That's correct. It was through a campaign called #ReachOut, where we used the helpline on offer with Fortis for anybody who was. This is not for people who are clinically depressed or have mental illness. This is for people who are just suffering anxiety, depression, want to get something off their chest, and therefore not what you would call psychiatric help, but just counseling and a patient ear to hear them. And Fortis had a system whereby they had about 15 languages, counselors in 15 languages, and you could call in and just have somebody to talk to. And what is very clear, and I'm sure there will be research in the years to come which will show this, COVID affected lakhs of people physically. It's affected millions mentally. And the true cost of that will yet to be known.
Yes.
Thank you so much, Mr. Nirula.
I just want to close this by asking you my last question to both of you. You're both in leadership roles, you're in senior management, so clearly you have an influence on what direction your company takes. Over the next 12 to 36 months. And I know these days that seems like a lot of time planning earlier in Punsi, but still we have to be optimistic about the future. And human nature is such that our resilience helps us get through. And what are the plans or course correction that Mohit, you are taking up in your organization to be able to both live up to your purpose and to your shareholder in terms of the business? And Richa, what is Fortis doing to be able to, in some way, deal with a future which may be very different than what it is today?
Let Richa go first.
So, Dr. Batra, one thing I would clearly say, what we felt is that while all the other sectors went far ahead when it came to information technology, healthcare, for some reason, lagged behind. So even before the pandemic hit us, thankfully, we had prepared ourselves. We had started to work in our information system, the complete IT ecosystem. And I must tell you that really helped us. And that's where the teleconsult came into play. So I would be very delighted to say that people like you and me, when we become patients, when it came to that, can we speak to the doctor online and take his advice? We would always think, no, I think we must visit him. Bina dekhe kaise hoga? How can he just advise us? But interestingly, during this pandemic time, almost if I would have consult of 6,000 per day, almost 30 to 40% of that number I'm doing on teleconsult. So you can understand the numbers going in lakhs when it comes to few months data. So that is something which we have determined ourselves to do, which is the IT infrastructure. We want to strengthen it further.
Understood. So more investment in technology.
Yes.
So that the delivery of healthcare and healthcare services using technology can look at a broader base to be served. That's one big focus area. Mohit, your...
Well, in many ways, the curve that we saw of supply and demand, or the gap that we saw between supply and demand for our communities, has just widened exponentially. As you can imagine, it takes us 3 to 4 months, 3 to 4 years to bring a project online from acquisition of land to getting it ready to welcome its first residents. The demand has gone through the roof, both for the communities that we already operate and for those that are under development. And the interest is both from buyers and from developers who want to partner us to create new communities in various cities around the world. It won't be long before we are in Richa's city as well. Coming back to the other big paradigm change that we've noticed is that the average age of our home buyer in a senior living community or in a community designed with seniors in mind has dropped to 50. More and more younger people are saying, this is the way I want to live my life, where I don't need to worry about 7 different agencies to provide me with 7 different services. I move into a community where everything's taken care for me today and as my needs change over time, so that my neighbors are my friends and my friends are my neighbors for life, rather than move stage by stage through life.
I think we'll do more and more conversations with you. We're doing specialist session on a lot of people who couldn't get the beds, lost out on insurance. So we're doing on insurance, and we're doing various aspects of healthcare and the healthcare allied areas which impact the lives of our viewers and our readers. So thank you for your time today. Thank you for your inputs. I hope we're able to take this consciousness and these inputs to be able to build a better healthcare policy. I'm sure if we don't focus on the healthcare and healthcare aspects now in a big way, clearly we'll not be the developed nation that we are. And just because we've had a bad 8 weeks and, maybe we could have handled it better. Not maybe, we could have handled it better. We can't not have the dreams that we've had for our country and for the citizens of this country. And healthcare, I would say, even in this time, doctors have done so much. Look, you talked about the mental impact. And I just want to end on a lighter note. During the lockdown, I watched this movie maybe 10 days back, I care a lot. Mohit, have you watched this movie?
Don't talk about it. I've watched it and I've not liked it. So please don't
Yes,
talk
clearly
about
I didn't like it. It was very disturbing, but
Yes.
it was made in a funny way, so you got by. But clearly, I just wanted to end on for those who are curiosity, you can watch it, but that's not how the Indian healthcare system is. It's America, and America is more commercial than any other country. Let's be very, very clear. And second is, I want to say that when it comes to healthcare, again, the doctors have shown, the paramedical staff has shown that they have been outstanding in going out on a limb. We've heard stories of doctors who didn't go homes, who didn't meet their loved ones, and we've known the number of fatalities in terms of doctors. And as Richa rightly pointed out, someone who's there to save someone's job and is not able, and if it happens in a disproportionate number, then it does impact you mentally. And I'm aware of, I read a book on a young doctor who was of Indian origin who died last year, and there's a book around him, and in that book, his best friend, who's also a doctor, commits suicide because, and it's a real story, so it's not like this is set in New York, because he couldn't save one patient, which he was very hopeful of saving. So doctors take what they do because honestly, one thing I realized while what everyone does is important. I think there is an insignificance of what I do. I mean, right, getting the right information, saying things that need to be said, even if they're uncomfortable, need to be said, and there is value. And but I think there was an insignificance of what I do. At least that's what I felt. What I did was not that important than what doctors do, what nurses do, or what. So clearly, I think really a salute to them, and you work with them day in, day out, and clearly contribute to who they are and what they do. So really, kudos to you and your whole organization. I salute you and congratulate you on your pursuit of providing healthcare, and we look forward. BW Healthcare World is a baby. I can call it a baby. It's a young editorial community for us, but we're determined to make it relevant and big and grow it. And I'm sure we'll have more conversation in the future. So look forward to more engagements with you. And clearly, Mohit will talk to you about the conference we will do. We're doing for seniors, which we pushed to August. We were earlier doing it in around April 10th, but clearly we're not doing it at least over the next 30 days. So we look forward to your involvement. Thank you so much.
Thank you, sir.
We'll have a conversation.
Thank you, Richa. Good to meet you. Thank you, Kavi. Thank you, Dr. Batra.
Thank you, Mr.
Thank
There
you.
is all mine.
Thanks so much.
Thank you so much.